Cropinion, Australian aged care, in relation to the Aged Care Royal Commission going on at the moment that has been overdue for probably 20 or 30 years. It's good to see it finally happen and expose what most of us could feel and know, that our beloved elderly that have contributed so much to this country, that have been through so much, people that are in aged care at the moment, you're looking at World War One, if not the Great Depression, World War Two, Vietnam, and raising children and grandchildren, paying taxes their whole life, and sad that some of them not getting the most honourable respect and treatment that they could be. It's a challenging topic and situation. When we all know when people get old, they tend to suffer from things like Alzheimer's and dementia, and there's no reason to treat elderly without the best intentions, depending on the situation. There are issues, of course, with the amount of carers, and it can be very difficult for a carer to be able to act the right way when, at times, with Alzheimer's and dementia and medications, that elderly people can abuse and lash out and be unruly in general. And unfortunately, medication can be a part of this to treat Alzheimer's or dementia, and that may wear off, and also to create, to treat any kind of injuries or pain that an elderly person might be going through. Unfortunately, a lot of carers and nurses, etc., are in that kind of work because they do care and they are empathetic, sympathetic, compassionate people. They can become stressed out and obviously overworked, shown mainly from this Royal Commission, and the staff can't be paid to care. I mean, if you're at the end of your wits or you're in a certain situation, a little bit more money or, isn't going to replace if you need someone else there with you. So there might be other elements in carers' lives that make them crack, or it might just be the situation where I heard a situation the other day where one resident lashed out at another elderly resident, and they pushed each other, and she hurt herself. But what it comes down to is there's not enough of a ratio. This is a society. It's not a society, it's an institution. It needs to become a little society of aged care. And these people, our elderly, are full of knowledge, and they're full of everything that everyone else needs, They've been through it all, and we need their knowledge and perspectives, and we just need them around. We need them around our children, our youth. So, as the Royal Commission has obviously pointed out the patient-to-care ratio, I feel at the end of the day, like things used to be, Willy Wonka and other perhaps old English films, that the elderly or sick or injured stay at home. This does affect the lifestyle and income, outcome opportunities for whoever's at that residence. So option one, of course, is to take care of your own parents or your own grandparents and have them with you and be their carer. I've been a disability carer before, and that is very isolating and very stressful not to have a break often. And so it's great to see the aged care packages wanting to come down from 2 years, which is quite disgusting, to 3 months. It's great for the elderly to hold their independence and their lifestyle that they've become familiar with. A lot of people build a home. You can't just move someone out of their home into a nursing home with strangers, or maybe friends from the same area that they've known their whole lives. But your house, your home, it's your elderly have gardens and furniture and other things, neighbours, rituals and habits that they're used to, and it's fair that they hold on to that as long as they can, because it gives them purpose. It's their life, and those things excite them and keep them going. So it'd be great to have these care packages come out. I mean, if they're too expensive or they can't be rolled out soon enough, I just had an idea before that it's been proven, on a side note, that this Work for the Dole program is not working. And a lot of people, and I've met a lot of people that work for the Dole, and they'll go out somewhere and I spend a few hours waiting for other people and getting together and have a debrief toolbox, and then explain what they've got to do, and then they'll do it for a couple of hours, and then generally they're just sitting around waiting for something to do and not being fully productive. Well, I think it would be a massive benefit on both behalves that Work for the Dole programs go and have to go into their local community to go to elderly's homes and help them with other carers and do a bit of a training program on the job, get ticked off, and then they can become Work for the Dole elderly home carers. And I mean, we have to admit, all around the world, and particularly Australia, we all know that Australia, from the baby boomers, more than any other country, maybe not any other country, sorry, but we have a rising age population. So the most obvious solution for me is to do what the Dutch have done in a very highly volunteering society. I'm going to post that little link up under this video, that we have students volunteering in nursing homes, whether in accommodation in a nursing home or close by or even not close by, and to substitute their living expenses, because we all know, if you've been a student or haven't been a student, you might know a student, that students are most often pushed into poverty if they're not working on their subjects for 45, 60 hours a week, and then having to do 12 to 20 hours work to get by, to get a little bit of extra money to eat a bit better, or to afford other expenses, or just to go and socialise for a bit. But how do you socialise when you with your peers when you're doing so many hours and then have to go to work? This is not sustainable. This is not emotionally sustainable. And it's also been brought up lately that the international students are further or more so impoverished because they are working harder, studying harder than we have to. So at the end of the day, it's just super obvious that we should be sharing the knowledge, linking the generations, to have student volunteers in nursing homes and maybe at home with other elderly people. So enjoy this little video of the Dutch experience experiment, and I think Australia should follow. Thanks very much. If you've got your own opinion, please post in video form. Bye.